As we continue to take safety measures to protect our physical health, we need to remember our mental health as well. Dr. Gail Saltz is here with more tips on handling stress and anxiety. Welcome, Doctor.
Hey, how are you?
I'm doing well, and I'm happy to have you here. Everyone does feel a little more stressed, though, or anxious at some point. But how can you tell when it's time to seek professional help?
It is time to seek professional help when you find that it's really interrupting your ability to function, meaning that the level of sadness or anxiety or other emotional symptoms are really with you a good chunk of your day every day for a couple of weeks. You find that it makes it difficult to concentrate. Perhaps it's interrupting your work. It might be affecting your relationships. Maybe you're finding yourself very irritable or angry a lot of the time, and have a kind of short fuse, or you feel like you're not taking pleasure in things that you used to take pleasure in. Those kinds of symptoms, particularly if it's interrupting your sleep or affecting your appetite, then those symptoms tell you there is a mental health issue going on, and you should definitely seek an evaluation.
And what's the connection between mental health and whole body health?
It's an intimate connection. Our brain is our most important organ, and it is connected neurologically to all of our other organs. And the reality is that when you have a mental health syndrome going on, you tend to get other kinds of physical health problems. It can affect your blood pressure, it can affect your gastrointestinal system, it can cause chronic headaches. So there are these ties, and it's important, therefore, in addition to the fact that, frankly, mental health symptoms really cause a lot of suffering in life, and they don't have to because they are very treatable. So for both of these reasons, physical health and mental health, it's important to treat mental health symptoms.
And what would you say to someone who feels that there is a stigma or just feels anxious about trying to seek out therapy?
Yeah, stigma has been the number one reason in this country that people have not sought treatment, but that's really changing. I'm actually partnering with Next Gen Health for this very reason, to talk about stigma and the fact that close to half of all Americans at some point will struggle with a mental health issue. So clearly, this is not something that's very unusual. And in addition to that, it's also true that treatment is very helpful, and it's not the kind of thing you can just do on your own. It's not a matter of just toughing it out or, pulling yourself up by your bootstraps. We know that these are biological illnesses like other illnesses, and they do require either psychotherapy or psychotherapy plus medication, sometimes medication alone. These are the kinds of things that are needed for treatment.
And what should first-timers expect during their first therapy visit?
You can expect that they will ask you a lot of questions about your mood and about your functioning and about your emotional thoughts, both currently but also somewhat in the past, meaning they're not going to go over every detail of your past, but, have you had these feelings before? Did you ever have treatment before? They'll ask you a little about your family history for your mental health history. They'll ask you what medications you're on so that they can offer you a proper treatment and look at any side effects medications may be having on your mood, etc. And you should expect confidentiality, total confidentiality from your treater, which means it's really important to be honest. The more honest that you can be and forthcoming you can be, because after all, we're not mind readers. We can only get our information from you. So the more that you can tell us, the better that we can help you.
And where can we learn more?
You can learn more at nextgen.com/nextgenmind. You can find where you can find treatment, different resources, and most importantly, you can also find how to set up a great telehealth appointment, because this year we've all discovered that telehealth is just as effective as coming in person, and sometimes it's more convenient, and sometimes it makes people more accessible to you. So I really advise you to check out how to make a telehealth appointment and how to have an optimal telehealth appointment.
All right, Dr. Gail Saltz, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.